Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is a conversation with the School of Public Health's newest epidemiology faculty members. Our guests are Dr. Kevin Maloney, Dr. Leah Scott, and Dr. Ya-Hui. All are assistant professors of epidemiology in the Department of Population Health Sciences for the School of Public Health at Georgia State University. Dr. Maloney is an infectious disease epidemiologist. His research interests include HIV and STI prevention, primarily among men who have sex with men. He has previously worked on efforts to increase pre-exposure prophylaxis uptake, or PrEP, and interventions for improving patient-provider communication and clinical management of PrEP. More recently, he has used mathematical models of HIV transmission to look at racial disparities in PrEP access and use among MSM, the potential impact of long-lasting injectable PrEP formulations, and the efficiency of PrEP distribution in the sexual networks of MSM. Dr. Scott's general research interests include identifying the various individual, policy, social, and physical environmental factors that drive social and structural inequities by combining spatial analysis, advanced statistical modeling, and epidemiologic methods. She aims to quantify the effects these factors have on cancer outcomes and cancers that disproportionately impact Black women, emphasizing triple-negative breast cancer. Her research focuses on the intersection of race and structural racism using population-based data to evaluate disparities in incidence, mortality, survival, and other outcomes. Dr. Yu's research interests include understanding the impacts of maternal metabolic abnormalities and pregnancy complications on the health of mothers and offspring, as well as drug safety evaluation for use during pregnancy. Another aspect of her research has focused on leveraging innovative methodologies and study designs to improve causal inference and observational studies using large administrative clinical databases. Today's webinar will be a conversation focused on our guests' career paths, passion for public health, and research. One quick note, if you have a question at any point during the conversation, please feel free to type into the Q&A box and we will try our best to answer. So let's begin. Dr. Maloney, Dr. Scott, and Dr. Yu, welcome to the webinar. Let's start with our first couple of questions here. Can you share a little bit about your journey to a career in public health and epidemiology? And can you give a reason why you have a passion for public health? And we can start with you, Dr. Maloney.
Yeah, thank you, Brian, for that introduction. So my introduction to public health really started as an undergrad at Drexel University. I was pre-med majoring in biology, and I didn't really know what public health was, much less epidemiology at the time. I kind of just thought public health was something that CDC did, and some doctors got a master of public health, and that's what public health was. But during my coursework as an undergrad, my interest really shifted upstream away from medicine with patients and really thinking about the determinants of health and why are some people and some communities impacted differently. So my interest really shifted to public health, and I took a step back away from the pre-med trajectory and thought more seriously about public health and figured out what that was all about. And so, after college, I got a job working at Beth Israel Deaconess Medical Center, investigating PrEP use in clinical care settings. And then at night, I completed my MPH at Boston University. And that's really where I became passionate with epidemiology and realized that this was the career path for me. That interest that was sparked, it was enough for me to really start to have more research questions and ideas, but I also knew that I didn't know enough to pursue these on my own. And so that's what led me to the PhD. And so I came down to Atlanta at Emory University for my PhD. I was interested in mathematical models and looking at HIV transmission at the population level. And so I built my work in that area in network science. And so, now shifting my, so we have all these tools for HIV. I mentioned, you mentioned PrEP in the introduction. And so these are outstanding tools. And, there's a lot of work left to do to increase PrEP use in the population, increase access to treatment, because treatment is also prevention. But in the world of STIs, bacterial STIs, gonorrhea, chlamydia, syphilis, we're running out of tools. So we have these outstanding antibiotics and now we're running out of them. And so I'm really interested in working in that area and antimicrobial stewardship. So I will leave it there for now.
Well, thank you. I thank you for telling us a little bit about that. How about Dr. Scott? How about you tell us about your journey to career in epidemiology and your passion for public health?
Yeah, so I will say my path was a little bit similar to Kevin's. I thought I was going to go to medical school in undergrad. I majored in chemistry and I got my first research internship. Those through NIH funded fellowships where they wanted to increase diversity in biomedical research careers. So I got my first research internship there. And at that internship, actually, I remember we watched Unnatural Causes. I don't know if anyone's seen that. It's a PBS special on health disparities. It's really great. And that's when I really started learning, wow, what is this thing called public health and what is this thing called health disparities? This is really great. I also worked in a lab there on triple negative breast cancer cells. And I found myself working in a lot of labs doing bench work that were focused on disparate outcomes, but we were looking at it from like the cellular level and potentially like treating cells versus the bigger population health level. So I knew I needed to pursue a graduate degree as a requirement of my fellowship that I had in undergrad. So I was like, okay, I'll go get my MPH and then I'll go to med school after that. So I came down to Georgia State to get my MPH, and I thought I was going to concentrate in health promotion and behavior. And I quickly found that that was not quite a fit for me. So I switched to Epi at like about a semester before I was about to finish. So I had to stay a little bit longer to switch over to Epi. While I was here for the first time, I had run a tutoring program at a middle school out in Bankhead. And at this time, I lived in Atlantic Station. If you know anything about Atlanta, it's about 15 minutes apart, but they're very different communities. And I would think like I would want to go get lunch while I was working at the school, and I wouldn't be able to get lunch nearby because there were no healthy options. There was not a grocery store. I had to drive to Cobb County to get lunch from a Publix regularly. And so I thought, if all of these kids live in these communities, where do they get their food? And this made me start thinking about the idea of place and health. So I ended up getting in contact with my advisor, Dr. Mobley, who has retired from Georgia State now, to really try to explore this idea of how can we take notice of place and health and how does space affect our health outcomes. So I ended up kind of moving into spatial epidemiology that way, social epidemiology that way. I pursued my PhD at Georgia State because I wanted to continue working with her and learning from her. And that's where I kind of had to make the turn back to cancer research, because cancer has a lot of really rich data that allows for broad spatial analysis. And I really wanted to be able to look at population-based data. And I ended up using in my dissertation a database that has about 100% of the cancer population in terms of incidence. That's what I needed to figure out what cancer outcome I wanted to look at. When I was working with her, I was looking at breast cancer in general, usually late stage diagnoses, or prostate cancer and colorectal cancer. And I needed to kind of forge my own avenue. And I kind of went back to looking at triple negative breast cancer since I'd already had that experience in undergrad. And I knew that it was something that disproportionately affected Black women. So it kind of led me right back to triple negative. And I kind of ended up sticking in the cancer epidemiology field. Once I left and did my postdoc, I was still doing some cancer epi from a spatial and population-based sense, but I wasn't necessarily focused on triple negative. But now that I'm here, I want to get back to being focused on triple negative breast cancer research and how the social environment and the physical environment really impacts these individual level outcomes.
Thank you. Dr. Yu, going to you, to let us know a little bit about your background and your passion for public health.
Thanks, Brian, and thank you all for having me. It was always fascinating to hear the story of others. So my career trajectory to epidemiology was slightly different. It went across different places and fields. So I grew up in Taiwan and I was trained in nutritional sciences, and I was also a registered dietitian there. So I first found epidemiology when I was taking a public health nutrition course. So this course was pretty different from most of my classes that were focusing on molecular science or individual therapists. So there was a professor who was really good at interpreting evidence from literature. So we had a really good conversation on her career path. And then I found like she was training epidemiology. So I started to digging a little bit more about epi, and I just fell in love with this subject about like how we can investigate the cause of disease through various study design and complex data, especially in the population level. So I went on to pursue a master's degree in epidemiology and stay in the same research lab for another 3 years as research assistant. And back then I was mostly focusing on collecting clinical data and study how to better define endophenotype of schizophrenia, which is a phenotype that cannot be observed. You have to perform some sort of a test to see the underlying biological reaction. And we also want to know like what's that endophenotype related to the relationship between the lipid metabolism. And I was also the lead coordinator for a national survey on substance use in Taiwan. So that was a period of time like I involved a lot of research, especially focusing on field research. So throughout my research experience, I know that I really enjoy the process of conducting research and would like to advance my knowledge and skill in epi. And I came to US in 2014 to pursue my PhD in epidemiology at the University of Pittsburgh. And after graduation, I continued my training at McGill University in Canada. This is when my research interest came into focus. After years of training in different fields, I studied the impact of cardiometabolic risk factor and complication on pregnancy. And since I'm studying this vulnerable population, most of the evidence were generated using observational studies. And this shaped another research passion of mine, which is to think about like, is there any ways better to improve the causal inference when we are using observational studies? So I hope that my research will have an impact on understanding the etiology as well as identifying effect of effective treatment for pregnancy complications, since pregnancy presented as a unique opportunity that we can improve the health of both generations. Thank you.
Thank you. Well, I'd like to dig a little bit deeper into your research. You've kind of touched on it some, so we can go in the same order that we just went a second ago. But if you would, just share with me a little bit about your research and why it's so important to you and so important to the field of public health. Dr. Maloney.
Going back to when I got started, my first full-time job in public health, it was right after we had this new clinical trial data that showed that PrEP works, which is HIV prevention. People take a daily pill to prevent HIV acquisition. And then we also had other clinical trial data that showed that treatment is prevention. And so people who have HIV, if they're engaged in care and they have a suppressed viral load, that prevents onward transmission of HIV. But one of the immediate problems, at least on the PrEP end, is that people weren't using it. And so there was a lot of work that was needed to get PrEP into the communities where it's needed most. And so there's still a lot of work on that end, particularly for young men, young gay men, in getting PrEP to them before they start engaging in risk behavior, not after. And then, particularly for Black and Hispanic gay men, where we're seeing HIV rates rise. So that's kind of what drew me in is these equity issues and having a clinical trial that shows that a tool works isn't everything. And so we need to continue to work to increase the access and awareness and uptake for the most vulnerable populations. But for me, what keeps me really engaged are these kind of like fun causal questions and like working with messy data. I love digging in and getting mathy, and it's hard. We don't like having messy data, but sometimes that's when it can be the most fun. I see Dr. Yu and Dr. Scott nodding your heads.
Dr. Scott, let's hear a little bit more about your research.
Yeah, so I think right now I feel like I'm in a phase of really trying to build out my path. You start doing that in your postdoc, but then you also have to like support whatever your supervisor and mentor wants you to do as well. So you're learning and growing, but you're not quite forging your own way. And I think there's something that's always been common in all my work is health equity is my focus. And of course, I always have Black women in mind. I am a Black woman. I have a home full of Black women, so that's where I'm always thinking from. When I think about triple negative breast cancer outcomes specifically, like we know with breast cancer, Black women are less likely to be diagnosed, but when they are diagnosed, they're more likely to die from breast cancer, and they're usually diagnosed with the more aggressive subtypes, such as triple negative breast cancer. And so there's plenty of work out there that looks at biological mechanisms that we haven't quite figured out why. My question is always, but why and what's going on? And with my interest in place and health, I'm thinking something else that may be driving these differences. We know that there can be life stressors that affect like biological pathways. So what is a life stressor that's common among Black women? That's kind of where I lead to structural racism and experiences of racism. There's been a lot of work done in that, looking at cancer outcomes and some structural racism. And I kind of want to continue to expand that and try to see how deep I can get. I think no matter what, I'm always in this area of like, how can I think about the social environment, the things other people aren't thinking about, such as what kind of access to healthcare you have, what kind of access to food you have. Is it about you or is it about the community you live in, right? If maybe you have all this access, but your community is really disadvantaged. So is that going to impact your outcomes as well, just because you have the access, but everybody else doesn't? I'm always trying to think of ways to answer these questions and trying to learn new statistical methods and implement other statistical methods, such as spatial analysis is my favorite thing to do. I love medical geography. I love maps and visualizing data. I think it's a really important way to communicate science. And it's a way that's really accessible to a lot of people. So I'm always thinking about how can I communicate science in a way to everybody that shows there's important things going on in terms of disparities for these various cancer outcomes. And we need to continue to figure out what's going on in order to progress in terms of having more equitable outcomes at the community level and at the individual level.
Thank you. Dr. Yu.
Yeah. So I think I'm like Dr. Scott, like we're also like trying to build up our own path, but I want to share a little bit about like what I'm like in the middle of right now. Like I kind of like think about this and I present a lot recently. So one of my current research focuses is to examine like the safety and effectiveness for GDM, which is gestational diabetes treatment. And for those who are not as familiar with the field, gestational diabetes is one of the common pregnancy complications. And since the current obesity epidemic and women tend to become pregnant at more advanced ages, GDM has projected to increase in the future. So we know that like how to better manage GDM is important. And insulin is currently the first line treatment for GDM since it cannot pass through the placenta to the fetus. However, insulin use require more clinical visit and injection. This may affect the patient's adherence. So oral anti-diabetics such as metformin has been proposed as one of the alternatives to insulin. but it raised safety concerns because it can pass through the placenta. In addition, there is lack of evidence regarding the long-term safety for offspring exposed to metformin in utero. So my research is to compare these two treatment on perinatal outcomes, such as large for gestational age and preterm birth, using a large population-based cohort in the UK. And I'm also looking at the long-term BMI and growth trajectories among those children born to women receive these treatments for GDM. So this project focuses more on constructing what would have happened for the health outcome if every woman received metformin versus insulin. So like this is my the project like I'm brewing right now. Is next step I want to look into, deep dive into like to identify the treatment heterogeneity for GDM, which is to identify subgroups that would benefit the most from different treatments. And this would be able to assist clinical decision making and based on the patient's characteristic and their obstetric history.
Thank you. Well, shifting gears a little bit, I'm just curious. We have most likely have some students on the attendee list today, and I just am curious if you all have some advice that you would give to your younger self. You know, maybe to the undergrad or the graduate student where you guys were just not too long ago. That would maybe be some good advice for leading to the career that you're currently in right now. What would you give to that student? Start with you, Dr. Maloney.
I would say one of the most valuable parts of my early training was my work experience while I was taking my master's courses. You know, I started working as a research assistant before I enrolled in the master's program. And so the work experience was very complementary with what I was learning in the classroom and vice versa. And so I was asking, or I felt I was asking better questions in the classroom based on my work experience. And then I was bringing those skills, you know, into the workplace constantly. Not everyone has time for a job. And so I get that. But I would encourage everybody to really reach out for those practical experiences, whether that's for a degree requirement, your thesis, or a practicum experience. But if not, you know, there are opportunities to reach out to the faculty here to work on something that you're excited about. If you're excited about it, chances are I'm going to get excited about it, or I can connect you with somebody who has that expertise. So that's number one. And number two really is diversify yourself to, you know, as best you can. You know, in my master's courses, I really focused on as many epi and biostats methods courses as I could. You know, but I also took a qualitative course, and that was an outstanding skill for the work I was doing at the time, and still now. So I can incorporate qualitative work in my research, and, you know, work with collaborators who do qualitative work and be like an effective partner on that research team, because I understand what they're doing, at least to a level enough that I can, you know, have those conversations. Looks like Dr. Scott's light went off, but they're back on. I guess I'll kick it to you, Dr. Scott, now that you have your light.
This light issue. So I will second all of those things. I think something that's really important to do is always reach out, whether you're reaching out to other students that you know, we're in a great school. I went to Georgia State for both my master's and PhD. And something I leveraged was not only reaching out to faculty, but I reached out to other students that I knew already worked at CDC. One of my fellowships I got was actually through a friend who was in my cohort who saw something that was in cancer that I would have never seen. And she passed it along to me, and I ended up going to interview for that fellowship and getting it. So I think it's really important to just constantly reach out and keep building your connections. Even if networking is uncomfortable, it's really, I do not enjoy networking, but I know it's important to my job, so I do it. Same thing is for advocating for yourself. I think that's something I still continually struggle with personally, but you know, putting it out there that like, look at this thing I've accomplished, look at this paper I was on, look at this report that I'm in, anything that's like advocating for yourself and advocating for others, you eventually build up a group of people who will post about you if you don't post about yourself, and vice versa. I think those are a couple of things. And then the other thing would be to not be afraid to say you don't know something and then to go and learn that thing. I think it's really important to kind of be like a perpetual learner, and keep expanding your horizons if you can. And people will enjoy and appreciate you being able to say, I'm not sure, but I can get back to you with that.
Yeah, I really enjoy listening to like those advices. Like I think my thought echoes to Leah and Kevin's a lot. So I feel like if you, for like students, like, or for my younger version self would be like, if you haven't found the topic that you are really passionate about, just keep trying different things. I feel like in my case, I've been working on several different areas, but when I look back, I found like I can actually connect the dots from different experiences. And then this is the unique part of your journey because everyone's trajectory is different. And then next is to reach out to people at the early stage. For example, if you are probably just about to graduate, like in the next 2 years, then you can reach out to people like, oh, what would like takes to reach to become a postdoc, or you just need to know what's the process down the road. So I was fortunate to have many good mentors along the way, but it still took me some time to navigate the system and to know what resources are available to succeed. And then I'm still kind of learning right now too. Yeah.
Well, thank you. That was all great advice from the three of you, and I appreciate you sharing it. And so I'm going to wrap up with my final question today. And one of the goals of this webinar series is to always think about ways that we can take the information that you all have shared and then put it in a practical aspect and a way for us to take it into our community and make a difference. So my question is there a way that we can take your research that you all are working on and share it in our community, or get involved, or learn more about it? Do you have any options or information for us to be able to do that? Dr. Maloney?
I'm an infectious disease epidemiologist, and so the main topic, which we haven't brought up today, is COVID. And so that's still happening. And so some of the work I'm going to be doing going forward is looking at some of the ripple effects and how COVID has impacted these other pandemics, HIV, STIs, tuberculosis, other things that haven't gone away. And so, you know, we're all remaining vigilant with COVID, but as we think about these other things, you know, re-engaging. And so as we try to get back to testing in the community, you know, these are things to pay attention to. And so if you have a testing initiative in your church or somewhere else in your community, bring your brother, bring your nephew, bring your son, you know, get people tested. So that's something that, you know, you can do in your own community. But in terms of our actual work, I think it's, you know, recommitting to these other things that are going on. And you know, even though everyone is exhausted from COVID, you know, that's kind of the biggest, most important next step for people in the Georgia State community or you know, alumni. You know, I have an open door policy. I'm here most days. You know, just come by and say hello, or shoot me an email if you're interested in the work that I'm doing. We can get involved, you know, work on something together, students. You know, if you have an idea, let's talk about it. You know, I'd love to chat.
Once again, in the same boat as Kevin, feel free to reach out to me if you're interested in anything specifically related to social epidemiology and cancer epidemiology. We do have a specific project that we're working on focused on, not related to cancer, it's actually focused on COVID-19 health equity, working with Fulton County. And there's a lot of work with community-based organizations, as well as some work that we'll be doing here in terms of survey implementation and epi analyses and geospatial analyses. So if there's any students who may be interested in working on something like that, can reach out to me regarding that. In terms of anything else related to, I think one thing I hope I can serve as a good connection for people who do cancer research and not just breast cancer research. So if you need that type of connection, I feel free to reach out to me. I'm starting to build my own personal connections with different community-based organizations, large organizations such as Winship and other foundations. But I think it's important just to reach out. That's my main thing.
For those who are interested in the field of maternal and child health, so this year GSU School of Public Health just launched a certificate program, which is especially focusing on MCH. So I think that would be a great way to learn essential skills and experiences related to MCH research. And in addition to that, there are also several student lead journal clubs and ASPER panels that you can attend. They are all like the ASPER invited, like either it's a local community, and then they were talking about the emerging issues that related to this field. And then as I introduced myself before, I just finished my postdoc fellow in Canada and relocated to Atlanta. So I'm really looking to see if I have more opportunity to have a conversation with local stakeholders. Since my overarching goal is to improve overall maternal and child health, and I'm always happy to chat about novel approaches, study design to answer any emerging issues that you are interested in maternal and child health, and please feel free to reach out anytime.
Excellent. I'm glad you mentioned the new certificate program. That's good information. So I do want to thank everybody for attending today's webinar. And I also definitely want to thank Dr. Maloney and Dr. Scott and Dr. Yu for providing wonderful information. Please save the date for our next webinar. It's going to be on Thursday, November 18th at 12 p.m. featuring School of Public Health faculty member Dr. David Ashley, and he'll be discussing vaping and smoking cessation. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master's of Public Health and degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health program. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. And also we have a brand new alumni page, and it's at publichealth.gsu.edu/alumni. So feel free to check that out. Thank you very much for attending, and we look forward to seeing you at our next webinar. Have a good day.